Hi, my name is Dr. Doug Lucas. I'm a board-certified orthopedic surgeon, and I'm passionate about educating and helping to prevent fracture from osteoporosis. I created Optimal Bone Health as a branch from my practice, Optimal Human Health, to help people to understand the risks of osteoporosis and to understand how we can best not only slow down bone loss, but improve both bone quality and quantity in an effort to prevent fracture. I left my traditional role as an orthopedic surgeon to pursue additional training in both functional medicine and precision medicine so that I could bring this to my patients. You see, the challenge of osteoporosis is that almost half of all adults over 50 are at risk of fracture, and most don't know that. Half of women and a quarter of men will fracture in their lifetime. The incidence for women of having an osteoporotic fracture is more than that of having a heart attack, a stroke, or breast cancer combined. And yet it's rarely discussed, and even unfortunately the incidence of screening for osteoporosis is actually going down, meaning that doctors are ordering the screening tests less frequently so that we're talking about the problem less often. When I see these fractures of particularly the hip and of the spine, it can have tremendous implications for both your quality of life, your health span, and your lifespan. Unfortunately, the traditional approach once you've had a fracture or you have a diagnosis of osteoporosis is that of briefly discussing, hey, you should eat better and move more. It's kind of the same thing it sounds like for losing weight. Just move more, eat less. It's this really, really brief discussion of lifestyle and then a discussion of medications right out of the gate. And doctors do that because those are the most powerful tools that they have at their fingertips. And that's not wrong. But a different approach, I have found, actually yields to much better results. So our approach at Optimal Bone Health is a team approach through nutrition with our registered dietitian and masters of nutrition, my expert in bone health medications, Clayton LeBaum, whom I've worked with for years and has a tremendous wealth of knowledge in the medication realm, and then my own background in functional medicine and precision health to help bring, again, this different level of care and prevention from an osteoporosis perspective. So we have created this program that looks at your genetics, that looks at extensive blood testing, functional testing to help identify, okay, where are you now? What is your bone quality actually like? Are you losing bone rapidly? How rapidly are you losing bone and why? Where is it coming from? And then create a plan that can help plug the holes. Is this coming from your gut? Are you not absorbing nutrients? Do you simply need better nutrients? Do you need a different diet? Bringing all these things together that we can then paint a picture that includes lifestyle, that includes targeted supplementation, that includes hormone optimization or replacement where appropriate, and that's a complex discussion, but a very powerful tool in the prevention of osteoporosis and fracture. And then have a discussion about medications, not because we're going to force medications on people, but because we want you to understand where medications can play a role, what the long-term effect of these medications are, particularly if you're in your 50s and 60s, when we have decades left to protect your bones from. We need to really understand when the medications can be used, for how long, what is the long-term plan, not just what are we going to do right now. So Optimal Bone Health is an approach where we use the team to help take you from where you are to where we think that you can be and where you want to be. So join us, click the link to learn more or schedule a free consultation with me to discuss your unique situation and how we can help you.